My name is Dr. Laura Perkle, and I'm a chiropractor in Rochester, Minnesota. I wanted to discuss with you some of the chiropractic concerns that we see when we first treat a patient in our office. One of the definitions of what I do is a movement or an adjustment or spinal manipulation, where I actually move each individual segment of the spine. Oftentimes this results in a release of pressure or a pop or a click called a cavitation. I have lots of patients that ask me what a cavitation is and where it comes from. Every joint has a capsule. Every capsule contains fluid. So I explain to patients that it's often like a water balloon. And if you open a can of soda or you pop a water balloon, you get a noise. This fluid and this joint and that capsule should not necessarily be under pressure all the time. It's normal to have some stress on a joint from normal activity and wear and tear. When you're accumulating more stress than you can eliminate, you need to visit a chiropractor and get that pressure to release. Different chiropractors do this different ways. Sometimes you can't hear or feel the click or pop. In my practice, where I practice with diversified manual technique, we often hear a cavitation. They have studied the fluid and pressure release from that joint and have found that there is a release of lactic acid and waste gas or carbon dioxide that come out of that space. The range of motion in that joint segment is actually already, right away, freed up to some degree. So the range of motion has already increased, and the pain generally dissipates. There is also at cavitation a release of endorphins and enkephalins that can reduce short-term and longer-term pain in that joint. If you have a question about cavitation, visit your chiropractor and ask them questions, or visit chironerd.com.